I've reviewed the patient's chart. The patient has no known allergies and is a full code status. I gathered my supplies, including clean gloves, performed hand hygiene, and donned clean gloves. Hello, my name is Alex Hammonds, and I'm going to be your nurse today. Can you give me your full name and date of birth, please?
Johnny Hammonds, 7/15/93.
Thank you. And today we are going to be performing a physical assessment. So basically, I'm going to start at your head and work my way down and look at your body and go from there. I have provided privacy. And are you comfortable, Mr. Hammond?
Yes.
The patient's blood pressure is 120/80, pulse rate of 90, respirations 18, temperature 98.6, and oxygen saturation 100% on room air. The patient is a 28-year-old male. He is 6 foot tall and weighs 305 pounds. The patient has no known allergies. Mr. Hammonds, are you having any pain today?
None whatsoever.
Thank you. Mr. Hammonds, can you tell me what time it is?
It's about 5 o'clock.
Can you tell me the city and state we are currently in?
We are currently in Fayetteville, North Carolina.
Can you tell me your wife's first and last name?
Alexandra Hammonds.
And Mr. Hammonds, can you tell me why you are here today?
I'm just here for a regular checkup.
Okay, thank you. Mr. Hammonds is clean, well-groomed, and has good posture. Okay, Mr. Hammonds, I'm going to take a look at your head.
Okay.
Okay, Mr. Hammonds, I'm going to take a look at your face. Can you raise your eyebrows really high for me? Okay, you can lower them down, thank you. Can you smile really big for me? Thank you. All right, now can you please close your eyes as tight as you can? Okay. Can you frown for me? Thank you. All right, Mr. Hammonds, lastly, I need you to show me your teeth. Thank you. All right, now I'm going to take a look at your eyelashes and your eyebrows. Okay, thank you, Mr. Hammonds. Mr. Hammonds, I'm going to take a look at your eyes. Okay, now I'm going to use this light and I'm going to shine it into your eye. Thank you. Now I'm going to put my finger in front of your nose and I'm going to ask you to look at the wall behind us. Now the finger. Mr. Hammonds, can you look at my finger, please, and follow my finger? Follow my finger. Thank you, Mr. Hammonds. Mr. Hammonds, I'm going to take a look at your nose now. I'm going to use this light to look at your nose. All right. Now, Mr. Hammonds, can you plug one nostril with your finger and breathe in and out through the other nostril with your mouth closed? Now the same on the opposite side, please. Okay, thank you. Mr. Hammond, I'm now going to look at your ears using this pen light. I'm going to look at the other ear. I'm going to look at your mouth now, Mr. Hammonds.
Okay.
Thank you. I'm gonna use my pen light. Can you stick out your tongue for me? Thank you. Mr. Hammonds, I'm going to look at your throat and chest now. I have assessed the patient's breathing for 1 full minute. Mr. Hammonds, I'm now going to listen to your heart.
Okay.
I've listened to the patient's apical pulse for 1 full minute. The apical pulse rate is 90. I'm now going to listen to your lungs. Breathe normally for me. Can you raise this up? Move this up. I'm going to move to the back. Everything sounds good, Mr. Hammonds. Okay, Mr. Hammonds, I'm going to touch your front and back, chest, and abdomen. Let me know if you feel any pain.
All right. I will.
Can you breathe normally for me? I'm gonna touch your back now. Thank you, Mr. Hammonds. Hi, Mr. Hammonds. I'm going to check your pulses in your neck, arms, and feet.
Okay.
Can you turn your head slightly towards me? All right, now slightly this way. Thank you. Can I see your forearms? Thank you. Now I'm going to touch your feet. Mr. Hammond. The brachial pulse is at the medial part of the antecubital fossa. The femoral pulse is in the midline point where the torso and the legs meet. The popliteal pulse is in the midway line on the back of the knee. And the posterior tibial pulse is right inside the ankle. All right, Mr. Hammonds, I'm going to look at your hands and feet. Can I see your hands? I'm going to look at your feet now. Thank you, Mr. Hammonds. Okay, Mr. Hammonds, now I'm going to listen to your stomach.
Okay.
Okay, Mr. Hammonds, now I'm going to feel your stomach. Please let me know if you feel any pain or tenderness.
Oh,
I'm going to feel just above your bladder. Thank you, Mr. Hammonds. I have assessed the patient's groin, genitalia, and rectum. Skin integrity is intact. There is no abnormal discharge, lesions, or protrusions. The patient's skin color is appropriate for his ethnicity. No bruising, moisture, scars, bleeding, wounds, fistulas, ostomies, or dressings were noted upon assessment. The patient's fingernails and toenails are an appropriate color and an appropriate texture. Okay, Mr. Hammonds, I'm going to look at your arms, hands, legs, and feet.
okay.
Can you turn for me? I'm going to look at your spine. Can you turn your head while I push pressure? Straight. Now turn to the side. Thank you. All right, now I'm going to put my hands on your shoulders and push down, and you push them up. Thank you. Mr. Hammonds, can you please squeeze both of my fingers at the same time? Thank you. Mr. Hammonds, can you press down against my hand? Thank you. Now can you press up? Thank you. Mr. Hammonds, I'm going to look at the joints in your body now. Can you look to the left and to the right? Can you look up? Now down. All right, can you turn for me? Can you bend over and then come back up? Thank you. Okay. Can you take your arms out and up? Now back down. You put your arms forward. Now back. Now can you roll your shoulder for me? Thank you. Now can you bend your elbow? Both of them, please. And then put them back down. All right, now can you put your hands out straight for me? Can you show me your palms? Can you take your hands in and then back out? And can you open and close your hands for me? Thank you. Mr. Hammonds, can you move your leg out front, now back, then outward, and back inward? And the same with the other leg. Thank you. Can you bend your knee backwards for me? And then back? And the other knee, please? Thank you. Can you bend your foot forward for me? Now can you push it outward? And with the other one, can you roll your ankle for me? And the other one? Now can you open and close your toes for me? Thank you, Mr. Hammonds. Mr. Hammonds, can you walk towards me? Thank you. I'm going to remove my gloves and perform hand hygiene. Mr. Hammonds, are you comfortable?
I'm very comfortable.
And can you reach your call bell?
I can.
Thank you, Mr. Hammonds. I will be back